Okay, so a few weeks ago, I tweaked my shoulder at the gym. It's moving the wrong way, did something to it, and I injured, the front of my shoulder right here. I'm a horrible patient. So, I didn't really do a lot of the things I should be doing. I did the classic, I'll just rest a little bit, let it heal. Of course that didn't work because what do I teach you guys all the time? That stuff doesn't work. But interestingly enough, now while I didn't do this, I can guarantee you if I put on Facebook or someplace online, I said, what do I do about chronic nagging shoulder pain? I guarantee you a lot of people would recommend something like a cortisone shot. And to be honest, that's kind of standard. It's what people have been doing over the years for, persistent nagging pain, especially in a concentrated area like this. They'll inject it with a cortisone to quickly get rid of inflammation. And the thing is, most of the time it works, okay? But it's really important that you understand what the cortisone is doing and how it works, because it may not necessarily be what you want to be doing for your shoulder, and it certainly doesn't promote long-term healing, which at the end of the day, that's what we want, okay? I'm 47 years old. I don't want to keep injecting this thing with cortisone and masking my pain because I want to keep going to the gym. I travel a lot, love taking my trips. I want to be able to lift luggage over my head into the compartment above me for years to come, okay? If I keep doing things like injecting my shoulder with cortisone, which I didn't do, but if I were to do that, I'm setting myself for failure, because what a lot of people don't realize is cortisone repeatedly will actually cause damage to your tendon. It can weaken your tendon, okay? And we don't want that. Tendons actually need to be loaded, they need to be strengthened properly, but sometimes when you've got a lot of pain, you're kind of stuck, right? You can't do the strengthening you need, you can't put the loading on that tendon that you need to improve it because you've got pain. The good news is that there are a lot of better options that work with your body's natural ability to heal. It's called regenerative medicine. It's been around for a while, but it's gaining a lot of attention and a lot of traction lately because people want to stay active for years to come. And you can't do that if you don't take good care of your body. So you may have heard the term longevity, right? These are the things that people are really interested in now. They want to do healthy, natural things to heal pain and improve the integrity, of their muscles and soft tissue. And things like regenerative medicine do that. Now, there's a whole family of options when it comes to regenerative medicine. I can tell you that there are two of them we do here in our office in Portsmouth, New Hampshire, called shockwave therapy and EMTT. And when used together, they're pretty magical. Something like that is going to be a better option for you than cortisone shot. It might take a little bit longer for the pain to go away, but it's going to be a longer lasting pain relief instead of short term. And you'll be able to do it without damage to your tissue. And then if you need more invasive things, there are other options like PRP, even stem cell injections. Now, I wouldn't necessarily go to those first unless you've got a tear in your rotator cuff. In that case, and you want to avoid surgery, you might want to look at something like PRP. But here's the thing, stuff like shockwave therapy and EMTT, when combined with the PRP, makes that PRP injection better, because this stuff isn't cheap and you want to make sure that you get the most out of your investment. So if you're wondering kind of the differences and the technicalities there, I wrote an article for you that talks a little bit more about why cortisone isn't always the best choice, and certainly which conditions you shouldn't even consider cortisone for, and how not only us but other places are using regenerative medicine to help people heal naturally. And the other thing I will caution you about is don't expect the regenerative medicine to be the whole thing. It's also critically important that you get the right diagnosis. You need to work with someone who knows how to look at, let's say, your shoulder properly to make sure that we're addressing the correct thing. It's really easy to just say, oh, it hurts here, and then this is where I do all my treatment. The problem could be coming from somewhere else entirely. So before you even go down the road of any treatment, always make sure you're getting the root cause addressed and identified properly. So that's it for me today. If you are like me and you do silly things that tweak yourself, regenerative medicine might be the best friend you never knew you needed, okay? Read the article, let me know what you think. You can share questions or takeaways in the comments, and definitely share this with friends or family members that need to hear it.